Hello guys, so good day. So this week our topic is about protein. Ayan. So today, mainly guys, so for protein per se, our test in the laboratory includes your albumin test, total protein test or total serum protein, and the computation of albumin and globulin ratio. So ito yung mga madalas. These are the routine tests in the laboratory. At guys, yun ang focus ng discussion natin ngayong araw. Yan. So, yun. So, yung mga albumin, total protein, and globulin. So, what are their clinical significance? What ba tinitest ko sa laboratory? So, doon lang nga magpo-focus dito sa laboratory natin, guys. Because yung mga primary structures, uses of proteins, ano pa ba? Mga major proteins in the plasma class, sa lecture na yun. But pwede ba akong mag-add ng konting mga katanong doon in our laboratory quiz ha? So, just to gauge kung how much you know about our proteins. What else? I'll focus on the methods, the methodologies on how protein is measured in the laboratory and protein electrophoresis. So, I hope na this something different from your lecture. Okay? So, hindi naman different, pero iba yung focus. Yan. Para naman, mas well-rounded yung knowledge nyo. So, so class, pag sinabi nating protein, test for protein. Ang rami kasing proteins. Pwede ang proteins in the form of enzymes, in the form of transporters, yan. Pero pag talagang protein ang pinag-usapan mo, ang nasa laboratory, ang itetest dyan is albumin, total protein, and globulins are computed. So, ayun. So, albumin ang one of your major proteins because it's one of the major protein fraction. Kuhan na yung pointer. Pointer. Parang iba na yung turn on. So, yan. It's the highest protein. It has the highest protein concentration. 52 to 62, percent. Yan. So, class, when we talk about proteins, the main organ that synthesize your proteins are your liver. So, class, pag may mali if there is decreased protein level, it actually could be due to your liver function. So, it's albumins are most of your proteins are synthesized in the liver, except plasma cells. Yan, yung mga plasma cells, they are the one that produces your gamma globulin. Your albumin is very important in maintaining your osmotic pressure. It's a transport protein. It's a negative acute phase reactant. So when there is inflammation, usually acute phase reactants proteins are the one that increases. Pag may inflammation, may infection, guys. Pero opposite sa albumin, pag may infection, may inflammation, decrease naman ang albumin. Kaya ang tawag sa kanya, negative acute phase reactant. So huwag niyo kalimutan, if there is infection, if there is inflammation, albumin will decrease. Yan. And it's a good prognostic marker in cases of cystic fibrosis. Guys, cystic fibrosis is a genetic disease very common sa mga Caucasian. Yan. Common sa mga Caucasian, sa mga puti. Plus, napaka-dangerous ng cystic fibrosis because in cystic fibrosis, the mucus of the body are excessively thick. Yan. So, ang lungs, may mucus yan. So, sabi excessively thick. So, kung makapal ang mucus, ibig sabihin, may nahihirapan huminga ang mga taong may cystic fibrosis. Yan. So, thick secretion of the different mucus. Yan. May isa pang organ ng affected pag cystic fibrosis, but something like that. So, especially lungs, yan. Class, kung alam niyo yung moving 5 feet away, I think yung sakit nila, cystic fibrosis. Meron to, 2 patient, apparently may cystic fibrosis sila. Never silang pwedeng magdikit. Kasi pag nagdikit sila, pwede nilang cystic fibrosis patients are very prone to infection. Pwede nilang mag-cause ang infection ng isa't isa. So, hindi sila pwedeng magkadikit. So, lagi lang silang 5 feet away. Tapos, nagkain laban na yun na. That's a sad story in the making. Yun. So, we have also Total proteins. So, total proteins, pag mineasure ang total proteins, guys, buong proteins. Yan, kasama doon ang albumin. Yan. So, measurements can reflect nutritional status. So, if the person is not intaking adequate amount of urine, especially pag malnutrition, poverty, guys, kidney disease. So, you are losing proteins through your kidneys, tapos iniihi mo. Example, nephrotic syndrome, liver disease, hindi nagsisynthesize ng maayos, hindi nagsisynthesize ng enough proteins, and other conditions like tawag that, multiple myeloma. Yan. Pag may multiple myeloma, dito, malignant proliferation of plasma cells. Class, huwag niyo kakalimutan, ha? So, sa lymphocytes natin, isn't it that, huwag niyo kakalimutan yung cells natin, ha? Yung main types of WBCs natin, never let monkeys eat banana. Never let monkeys eat banana. So never, M, neutrophils, L, lymphocytes, M, never let monkeys, monocytes, eat, eosinophils, B, basophils. Yan. So sa lymphocytes natin, guys, may dalawang types. T cells and B cells. T cells and B cells. Guys, your T cells, class, usually are your killer cells. So, pag may mga tumor, ayan, papatayin talaga nila yan. But your B cells, class, once it's activated, it will differentiate into a plasma cell, and it could produce antibodies. Yan. Your antibodies are made up of gamma globulins, which are proteins. So, isa pa. So, your lymphocytes, guys, has two types. You have T cells and B cells. Your T cells, example, T suppressor cells, T killer cells, yan. Talagang matinig itong mga T cells. Talagang, they are immune surveillance. So, nang papatay talaga ito ng mga tumor cells, ng mga virus. Yan. However, we also have B cells. Your B cells have an ability to differentiate into your plasma cells. And once it becomes a plasma cell, it could produce antibodies against antigens. So antigens could be foreign substances that could enter the body. So yung antibodies natin, class, are made up of proteins which are specifically called gamma globulins. Yan. So class, pag may multiple myeloma, maraming plasma cells, marami ring gamma globulins. Yan. So yan, pag hyperproteinemia, may kidney disease, example, nephrotic syndrome, liver disease, chronic liver disease, malnutrition, hyperproteinemia, dehydration. Yan. Actually, dehydration is a relative hyperproteinemia. Hindi naman sa literal na mataas ang protein mo, mukha lang mataas kasi there is decreased plasma levels. Konti ang nagdadilute sa proteins. Nagigets ba? Class, the person is dehydrated. The person do not have enough plasma. It's not that the plasma in circulation is water. Yan. So if there's not enough water, your proteins are not diluted. Hindi sila na-dilute. Nagmumukha silang marami. Hindi dahil marami sila, but dahil konti ang fluid sa katawan. Yan. Hyperproteinemia happens in increased gamma globulins. Example, multiple myeloma. If there is proliferation of plasma cells. Yan. So class, there's no concrete computation of globulins. However, I complete direct measurement or test for globulin. However, we just multiply total protein minus albumin. Yeah. Globulin usually increases in cases of multiple myeloma. So class, pag sinabi natin proteins per se, ang tinetest, so albumin. Yan. So if you want to test the, it's an indirect test of the liver's ability to synthesize protein. Yan. So your albumin is a negative acute phase reactant. So if there's inflammation, expect it to decrease. Yan. It's an important protein for osmotic pressure. So changes in albumin, pwede kang magka-edema, pwede kang may pagka-manas. And prognostic marker for cystic fibrosis. So if there is good prognosis. Yan, kung may chances of curing talaga or being treated. Yan, albumin. So class, ito, albumin over globulin ratio. Yan. So, mahalaga tong albumin globulin ratio as our guide, on differential diagnosis of your diseases. So, A over G ratio is albumin over globulin. So, pwede mo, di ba ang globulin nakukuha total protein minus albumin. Yan. So, that's AG ratio. The normal range should be 1.5 to 2.5. Okay. So, una, test muna natin yung total protein. So, pag yung total protein, more than 8.3 gram per DL, the person has hyperproteinemia. If the total protein is, ang tingin mo na total protein less than 6.7 gram per DL, it's hypoproteinemia. Okay? So, first step is get the total protein and assess if it's hyper and hypoproteinemia. Yan. So, if there is, step 2, now compute for AG ratio. So, if there is increased albumin or globulin ratio, yan. Pag ang hyperproteinemia tapos increase pa yung AG ratio, most probably it's caused by your dehydration. You could also check your electrolytes. So, decrease rin yung mga electrolyte level, yung sodium, potassium chloride. Yan, most probably that's dehydration. And what else? Yan, pag decrease naman ang AG in cases of hyperproteinemia, perhaps it's caused by chronic infection or multiple myeloma. Yan, multiple myeloma. So, nagde-decrease ang AG ratio kasi nga, yung globulin, pag yung globulin, tumaas yung levels, bababa talaga yung AG ratio. Yan. Next class. So, pag hypoproteinemia naman at increase ng AG ratio, most probably it could point to your kidney disease, liver disease, and malnutrition. Of course, class, your AG ratio, your total protein, guys, are only guide for diagnosis. You could, since kidney naman ang hanap natin, we could use urinalysis, we could use other kidney profile tests. Yan. So, this is just a good guide. Yan. For the clinicians or for differential diagnosis. Yan. So, di ba, class? Kanina, tingin mo tayo dito sa total protein. Tingin mo tayo dito sa total protein. Kasi ito naman yung first step. So, notice lahat ng mga decrease. Yan. There is liver damage. Yan. Hepatic damage. Decrease. Malabsorption na rin pala. Yan. And inadequate diet. Example, class, in cases of sprue, yan, di maka-absorb ng ang katawan properly ng amino acids, ng protein. Ayan, decrease talaga ang total protein mo. Immunodeficiency. Yan, immunodeficiency. Ano bang example ng mga immunodeficiency, ma'am? Like AIDS, hindi HIV, AIDS. Yan. Dehydration, class, di ba? This is a relative hyperproteinemia. Mataas ang proteins pag dehydration because there's now not enough fluid to dissolve your protein. And multiple myeloma, di ba? There is malignant proliferation. Pag malignant, di ba, sa cancer, masyadong marami ang naproproduce na plasma cells. So, class, dangerous din pag masyadong maraming antibodies sa katawan. Ayun. So, yun, di ba? Di ba yun nung una, total protein, kung increase or decrease, huwag niyo kakalimutan yun ng class. So, hindi na kailangan i-memorize eh. So, pag hypoproteinemia, expect it in liver damage. Kasi nga, yun nga yung nagsisynthesize ng protein eh. So, pag nasira yun, hindi okay yung pag-produce ng protein. And kidney disease, so you are losing your proteins via your urinary tract, your urinary system. What else? Malabsorption and inadequate diet. Ayan, nephrotic syndrome decrease. Ayan, so, observe na rin ito sa globulin. Of course, expect increased globulin sa multiple myeloma, increase ang globulin sa dehydration. Okay. So class, andito na tayo sa methodologies. Yan. So how are protein measured in the laboratory, ma'am? Ano yung mga principles? So first one is refractometry. So we use a refractometer. Yan. So measurements of the refractive index due to solutes in serum. Yan. Refractometry. We use the refractive index. When we say refractive index, class, it's the bending of light, di ba? Refraction pala is the bending of light. Yan. So, your refractive index, class, could reflect as well the number of solutes in your serum. Yan. So, pag sinabi natin yung solute, these are the undissolved particles or yung mga molecules in the solution. Biuret method or Bure method. So class, upon the addition of Bure, so your Bure reagent has copper. So your copper, guys, binds to your peptide bond. So class, ang Bure method, class, nagiging positive siya pag may peptide bonds. Yan. So yung copper nagre-react sa peptide bond. Class, lahat ng proteins may peptide bonds. Yan. Especially, peptide bonds are used to connect your amino acid to one amino acid. Yan. So, Bure class becomes positive if there's a presence of peptide bond. And peptide bonds are only found in proteins class. Ha? So, ayun. So, if it's positive, it will produce a purple color. If it's negative, there's no peptide bond. So, carbohydrate, yung nilagyan mo ng Bure reagent, guys. So, blue yung lalabas doon. And you can measure it spectrophotometrically at 540 nanometers. We also have Kjeldahl method, class. Kung ang protein nyo may peptide bond, meron ring nitrogen portion ang protein. Yan. So, ang Kjeldahl method naman, ang dinedetect niya is that nitrogen. And the nitrogen is converted to anemia upon the addition of sulfuric acid. So, yung nitrogen, yung ammonia in nitrogen, nitrogen in ammonia, nitrogen in ammonia is measured. Yun, tama. Nitrogen in ammonia. So, cluster protein has nitrogen. Yan. So, kanina, kung sa Bure, yan, na-measure, nahanap ang mga proteins via the presence of peptide bond na detect. Galing ng mga scientists, no? Sa Kjeldahl naman, dinedetect ang mga proteins dahil sa nitrogen niya. Yan. So, kaso, ang upside dito, hindi lang kasi protein ang may nitrogen, pati yung mga non-protein nitrogen. Mga non-protein nitrogen substances. Example is urea. So urea is basically a non-protein, hindi siya protein pero may nitrogen siya. So, yun yung upside dito. So, itong Kjeldahl method, it's good for measuring proteins. It's good for measuring non-protein nitrogen because it measures the nitrogen portion. Yun na. So, kung si Bure, minimeasure niya yung peptide bonds, si Kjeldahl, ang minimeasure niya protein. Ha? So, your nitrogen is converted to ammonia. And your ammonia is quantitated through Nesslerization. Yan. So upon the addition of a Nessler reagent, we have Berthelot reaction, which is good for blood urea nitrogen test. So yung pangalan niya, blood urea nitrogen. So itong Berthelot, gusto ko siya sa BUN, sa mga non-protein nitrogen. And we have titration. So you could measure your nitrogen through upon the addition of a titrant. Yan, dito na tayo sa albumin methods. So, how do we measure your albumin? Yan, so it can be measured through salt precipitation or salt fractionation. So, to measure your albumin, kailangan mo munang i-precipitate yung globulin. So, kailangan mag-settle. The globulins are salted out and it will settle at the bottom of the tube. And what remains in the supernatant, yung liquid upper portion, is albumin. And this albumin could now be quantitated via turbidimetric methods and nephelometric methods. Yan. So your urine, your CSF could be measured to turbidimetric. Turbidimetric. So paki-double check yung turbidimetric ko. So first, for salt precipitation is globulins are precipitated and your albumin remains in the supernatant. So ito na. So albumin is quantitated via turbidimetric or nephelometric assay. Diba? Napag-usapan na natin kung paano mag-measure ng concentration ng nephelometric. Diba nephelometric, if you remember, it's how much light is scattered. And dye-binding methods. Yan. So your albumin could bind to anion dyes. Yan. Your albumin has ability to bind with anion dyes. So ito ano mga pwede? Ito bromcresol method at 600 nanometer. Ito yung nasa manual natin. So it's sensitive and it's usually performed. We have methyl orange. Actually, it's non-specific. We have haba. Yan. Paki-check kung ano yung sabihin ng haba. And we have bromcresol purple. It's specific, sensitive, and precise. Yan. And finally, I think this is one of the highlights of our discussion for today. Yung dilim na. So this is protein electrophoresis, guys. So according to Bishop, your protein electrophoresis is very accurate because it gives you an overview of the different protein fraction. So it does not only just give you your albumin, total protein, kasi ang bibig nitong mga measure, but you could also see your levels of alpha-1 trypsin, haptoglobulin, ceruloplasmin, beta-lipoproteins, and immunoglobulins. Yan, ang ganda nito, protein electrophoresis. So the concept here is that we could separate the different protein fractions by electrical charge. Yeah. So those which are negatively charged would migrate to the anode the fastest. So anode is the positive electric charge pole. Yung positive side. So, di ba, opposite attract. So, yung mga negative charge pupunta usually sa anode. So, ang galing ng protein electrophoresis, class. So, it's giving an overview of the different plasma protein fractions based on electric charge. Yan. So, naghihiwalay-hiwalay yung mga protein fractions. Yan. So, class, mapapansin nyo, ang fastest in the anode is albumin. Actually, ang mas mabilis is pre-albumin or transthyretin. So, albumin, kaya may pre-albumin class because it migrates before albumin. So, pakitake note lang, pinakamabilis towards your anode is your pre-albumin or transthyretin. I think maganda lang tong image na to, kaya ito yung pinili ko kasi pinapakita niya yung mga plasma fractions na nagmamigrate dun sa depends on the different plasma fractions. So you would notice that your gamma globulins are the slowest towards your anode. Yung immunoglobulins or your antibodies, sobrang bagal nila. Okay? So, ang susunod, sa albumin, meron pang pre-albumin bago sa, dito yung pre-albumin. So, after ng albumin class ay ang mga alpha-1 proteins. So, alpha-1 proteins. So, alpha-1 proteins ang tawag sa kanila kasi nagmamigrate sila sa alpha-1 area. So, example of alpha-1 is alpha-1 antitrypsin. We have tyrosine globulin binding. TGB. And please paki-search kung ano nang isabihin ng binding globulin. And kung ano isabihin ng TGB. Sa alpha-2, makikita mo ang haptoglobin, ceruloplasmin. So, alpha-2 macroglobulin ang pangalan niya kasi nagmamigrate siya sa alpha-2 area. We have mga beta-lipoprotein, transferrin. So, beta ang tawag sa kanila kasi nagmamigrate sila sa bandang beta. Gamma sila kasi na gamma globulin, nagmamigrate sila sa gamma area. Sino yung pinaka-mabagal, ha? So, please take note kung ano yung migration nila between your anode to your cathode. So, your negatively charged particle are attracted to the positively charged pole. Yan. So, what else? Yan. So, the support media are cellulose acetate, agarose gel, starch gel. Your stains are your amido black, ponzu S, and kumasi brilliant blue. Yan. So, class, yan. So, yung mga zones natin. So, this is a densitometric pattern. Yan. So, the density could be measured by your densitometry. So, number 1 is pre-albumin. Yun, yung pinaka-nauna. Number 2, albumin zone. Number 4, yung alpha-1 zone. So, alpha-1 antitrypsin andon, alpha-1 glycoprotein, and so on. So, kanya-kanya sila ng migration. Yan. Alpha-2, yung microglobulin at haptoglobin. Actually, haptoglobin. Yan. Pakisearch kung, if I'm not mistaken, they are part of immunoglobulins ang haptoglobulin. Acute phase reactant rin to. So, class. So, dito sa left, na nakaharap ako dito, ito, yung reference pattern, class. So, ito yung reference pattern ng densitometric measurement ng protein. So, itong pinakamataas usually is your albumin levels. Dito banda yung alpha-2, alpha-1, alpha-2, beta, gamma area. Yan. So, class, so, ito yung albumin. So, kung tumaas to or bumaba to, kung tumaas sila, bumaba, it could signify different diseases. Example dito, sa inflammation. Yun, sa inflammation. So, pag inflammation, guys, expect that the acute phase reactants, the different acute phase reactants found in your alpha-1 area, alpha-2 area, and beta area will increase. Yan. So, notice nyo yung reference area, yung reference pattern. So, may pag-umakyat. Yan. Di ba? Yan. Tapos, guys, di ba, sabi ko sa inyo, yung mga albumin is a negative phase reactant. So, kumunti, hindi naman bumaba, pero kumunti. Yan. So, the width, notice the width. Yan. Next class, alpha-2, alpha-1 antitrypsin. So, alpha-1, expect that in the alpha-1 area, there is decreased density of your alpha-1 fractions. Yan. Galing, no? Guys. So, actually, marami pang iba sa Bishop, pakibisita. What does your cirrhosis pattern look like? If there is monoclonal gammopathy, yan. Anong itsura nung reference pattern? Please, pakibisita naman si Bishop, okay? And finally, guys, we have urinary proteins. So, urinary proteins are common proteins, guys. It's more commonly detected compared to your CSF proteins. Yan. So, class, the common specimen for urinary proteins is 24-hour urine sample. However, class, we could use random sample at in the routine method. Pero sabi ni Bishop, usually for urinary proteins, dapat kung urinary proteins ang naman yung measure, 24-hour urine sample. So the routine way of measuring your urinary proteins is urine test strip. Yan, urine test strip. Actually, pinag-aaralan to sa clinical microscopy. Yan. However, dagdagan natin dito para kumbaga, hindi foreign. So, pagbabalikan nyo, parang naturo na yun. Hopefully, so, maalala nyo. So, yan, protein error of indicators, yung principle ng urine strip. Protein error of indicators because may indicator usually. Example is your bromthimal blue. So, yung indicator is bromthimal blue. Pag negative ang bromthimal blue, yan, hindi siya nag-interact sa protina, yellow siya. But your bromthimal blue becomes blue from green, yellow, green to blue. when it interacts with the protein. Yan. And specifically albumin. Yan. So, ayun. So, the indicator is yellow. Then, changes to green depending on the concentration. So, kunyari, may 0.3 gram per liter ng protein. So, light blue yung lalabas na color ng urinary strip. Pero pag mataas, more than 10 grams per liter, so blue yung lalabas na color. Yan, sa kalangan ng mata. Yan, kailangan ng mata manually, pero pwede rin pabasa sa machine. Yan. So, other urine protein methods is Bure, Folin-Lore, yan. So, gumagamit ng mixture of phosphatoxic and phospholipid acids, dye-binding methods, turbidimetric methods, yan. So, please go over. Yan. So, guys, kung hindi pa kayo nakakita ng urine strip, ganito siya. So, actually, the different squares represent the different tests. Yan. So, yung pinakataas na square, it's measuring the levels of leukocytes, the levels of nitrite, ito. Protein, yung third natin, the levels of protein. Yan. So, klase iba-iba ang interpretation depending on your dipstick test or kit. Ganyan. Iba-iba. Depends on them. Yan. So, ang ganda, no? So, glucose, pwede mo na malaman sa ihe, pH, yan, ketones, yan, ang ganda. So, the most common one, so the principle of proteins in your urine stick is your protein, yan, error of indicator. So, yung indicator na binanggit ko is bronchimal blue. When there is no protein, it's usually yellow. However, if there is high levels of protein, it would be blue. Yan. If it has few to moderate levels of protein, green. Yan. So guys, if you have any questions, so thank you for joining me in our discussion. So I'll see you again. Bye-bye.